My name is Doug Shadell, and I'm the State Director of AARP Washington. We have Governor Jay Inslee on the line, and we're discussing some of the top issues being considered in the 2016 state legislative session. Again, if you would like to pose a question to the governor, please just press *3 on your telephone keypad to be connected to an AARP staff person. And Governor, thank you for being on the call today. I want to just throw it to Kathy McCall, who's going to ask you our first question.
So thank you, Governor. I know this is an extraordinarily busy time for you and your staff, so I want to thank you for taking the time out of your schedule to be here. And I know that funding education is a key priority for you in the legislature, and I wanted to see if you could just briefly give us an update on how that's going and also how you continue to balance all the other needs that this state has, and also an update on Healthy Washington.
You bet. Thanks for asking that question. I've ascended to the most important job in the world, which is grandparent here recently, and I also reached the age 65, so I am even more focused on the education of our grandchildren than ever before. The situation is that we have to find a way to take the third big step in financing education. We've taken two big steps in the last 3 years. We've invested an additional $5 billion in the education of our children, and we're doing some really great things. We're having big strides in early child education for those 3- and 4-year-olds that we want to make sure are ready. We're having full-day kindergarten for all of our children. We're reducing our class size down to 17 for kindergarten to 3rd grade. We have new mentorships for our teachers, and we have a long overdue teacher salary increase. And one thing I'm very proud of, there's only one state in the nation that has reduced tuition payments for our college students in the whole country, and it's the state of Washington this year. So we've made some really large strides for our paramount duty, which is the education of our kids and grandkids and great-grandkids. But we have to take another step forward to finish this project of financing our schools and reducing the burden that falls on local taxpayers for their local levies. This is both our constitutional duty and a court mandate. I think people know that the Washington State Supreme Court has ordered the state to move forward in this regard. So this year it's really important for the legislature this session to pass a framework for that final piece of the puzzle so that we can come back in the legislative session of 2017 and actually finance this. The good news is we've had some bipartisan success on this. I formed a bipartisan task force. They came up with a plan. We've had a little roadblock. The Republican Senate wants to delay this a year and move back the deadline a year, and I just don't think that's going to cut the mustard, so I'm hopeful that this bipartisan plan will eventually work its way through the legislature. Now, it's really important when we talk about this financing, as a legislature, not to finance schools by taking money out of seniors programs or taking money out of housing programs or taking money out of health care programs. It just doesn't wash to, end senior nutritional programs and finance schools by doing that. That's not the way to do this. And it doesn't help kids either. It's hard enough to educate kids. It's almost impossible. They're homeless, hungry, and sick. So we've got to find a better way to skin this cat, and I'm urging legislators to do that. So I'm hopeful that we'll get this framework through. It's very important to do that. Thanks for asking for our Healthy Washington. We've got so many things going on. The most exciting thing in the moment is we just rolled out our Alzheimer's plan for the state of Washington. And this is a hugely important thing for our state to have a strategy to move forward on this, because something like 1 out of 5 of us and many of our family members, we've all been touched by this. I certainly have a flavor for this because my father-in-law suffered for Alzheimer's, and I saw the courage of my mother-in-law going through that with him. And so this is close to my heart. And we had a really good rollout just a few days ago of our Alzheimer's plan that will focus on helping caregivers, family members who are in such stress in a variety of ways. And also we want to focus on research to be able to find a cure. And we've got great companies right now in the state of Washington and research facilities doing work on this. So that's the first thing that springs to mind. At the other end of the spectrum, we're really keen on reducing tobacco addiction and nicotine addiction in our state, particularly for our kids. And we know how damaging nicotine addiction can be to our health, and we've got to make sure our kids don't take up that habit. So we've been working on it. Most recent thing that's happened is we've passed our bill to reduce the danger of e-cigarettes becoming a path to addiction, and we passed that bill out of the House. We're very keen on physical activity and nutrition for our children as well. We're making some strides on that. We want to make sure our kids are active in school and have PE and can be running around so that they can have oxygen to their brains when they get to their computers a little later. So that's kind of a quick rundown of things going on, and I probably should stand for some more questions.
Excellent.
Thank you, Governor. If you're just joining us, that was Governor Jay Inslee talking about the issues going on in the state legislative session. This is an AARP Teletown Hall, and we now have almost 7,000 people on the line. Governor, last week we held a lobby day, as you know, in Olympia and delivered over 7,000 petitions to support the CARE Act, which I know is something that you support. And one of the people at that meeting before we delivered these told this horrendous story about her husband being discharged from the hospital, and he was going to be on 20 different medications, and they really didn't give him much in the way of detailed information about how to do this, even though she's a completely competent human being who's, been around the medical community and so forth. Could you talk a little bit about why the support for this CARE Act, which, as you know, would require hospitals to give more specific instruction to people before those patients are discharged?
You bet. This is one of our strategies to improve health and reduce costs of health care, and both are important. And what we're finding is that we have very disparate readmission rates from hospitals, so that when people have surgery, they come out of the hospital. Some hospitals are really good in providing discharge plans for their patients, so they know how, when to take their medication, how much to take, when to check in with their physical therapy, and they really have good planning. But others are not so good, and for those that are not so good, they have readmission rates that are much, much higher. So they have a much higher rate of people that have to come back to the hospital because they didn't have adequate medication, they didn't have adequate physical therapy, they didn't have knowledge about when to come in if there were problems. And what we're finding is if you provide people really good discharge planning and a bit of counseling or education for the patients, you can really decrease the need for patients to go back into really expensive and troublesome readmissions. And obviously, if you get infections, you have relapse, that's not a happy thing for people when that happens. So it's obviously not just a financial issue, it's trying to improve people's health. So this bill is getting some good support. I'm happy about it. It's a small thing, but it's one of those things that when you do small things, you can really get better health outcomes. And what we're finding is that some things that kind of are common sense can really make a difference. We've seen that in hospitals that have embraced this radical idea that caregivers need to wash their hands and reduce the rate of infections in hospitals. And that doesn't sound like rocket science, but now that we have embraced new protocols, we've really reduced the infection rate in a lot of hospitals. We're also, asking hospitals to sort of have public disclosure of their results. And that's something that can help incentivize, really quality care. And we're seeing improvements. Look, hospitals are having good leadership. They are improving the care of our people by doing these sort of common sense things. So this is one more common sense thing forward. I'm happy about it.
Thank you, Governor. If you're just joining us, my name is Doug Shadell. I'm the State Director for AARP Washington in Seattle. And you're listening to Governor Jay Inslee with a group of AARP volunteer leaders and staff down in Olympia. The legislative session is steaming along, and I know you have your hands full and can only be with us for a couple minutes, Governor, but I really appreciate that. We had a question, you mentioned it in your opening about the importance of being a grandparent, and we had a question from Joan in Federal Way. I just want to read this to you and get your response. I was recently asked to sign a petition related to the rights of grandparents. I know you're a grandparent. What rights should grandparents have in your view?
Well, of course, I think grandparents are the most important people in the world, of course. That goes without saying. It's interesting. I have not thought about this issue. I'd be interested in taking a look at this proposal, and I'm going to ask my staff here. Jason, who's done great work for us, will give me a briefing on this subject. So I'm just not familiar with it at the moment. Okay. I do know that this is an issue worth thinking about because very sadly we're having an increase in number of our children who are not in a position to act as parents. And we know more and more grandparents who are having to step into the role of caregivers for their children. And it's really a terrible sadness. Frequently it's a result of drug and alcohol challenges that our children have, and so grandparents have to step up to the plate. And that's a challenge. I spoke to a grandparent the other day who lost his daughter, and he said, geez, I've got to step back into the role of a parent at age 65. And he said, frankly, that wasn't in my life plan. I was going to retire and, live the life of Riley on the beach, and now I'm back into raising a 4-year-old. So right. I will look forward to learning more about this to see if there's some work we can do.
That's great. Let's take a live call now. We're going to go to Diane in La Conner. Diane?
Good morning, Governor. Thank you very much for your time. My question is about seniors who have to pay exorbitant amounts to get hearing aids. I'm 78 years old. I need new hearing aids, and I have been given prices anywhere from $3,000 to $5,000, which I would have to pay myself because there is no Medicare or anything else. Medicare covers glasses, they cover dentists, they cover major surgery. Why can't they put a portion of that money towards seniors to help desperately to need hearing aids?
Well, thanks for your question. I'd be interested in your experience, and maybe offline I can ask you to share your experience with us about that disparity in price. I would be really interesting to see why that is. So
I'd be glad to help you.
When we're done with this call, maybe you could send us an email or call the people on the phone here, and so we can find out about your situation. I think the larger question, though, is, how do you get coverage for audiologists and hearing aids? And that's just a question of cost associated with the Medicare program. And the question is that possible to add that to Medicare? It is possible. There's just a cost associated with that. But given how important this is in people's lives, maybe that's something that the federal government can think about, adding coverage. And maybe even if it's not total coverage, perhaps the federal government could come up with some partial coverage, because we know how important this is. All I know is when I start giving speeches, I notice a lot of seniors turning off their hearing aids, so I'm not sure what the problem is there, but thank you. I hope you'll share your story with us so we can check this out. Thank you.
Thank you, Governor. And if you're just joining us, we are doing an AARP Town Hall with Governor Jay Inslee. If you would like to call in, press *3 on your telephone keypad, and you'll be connected to an AARP staff person who will note your name. We now have over 8,000 people on the call, and there's lots of questions coming in. Let's go to Patricia in Edmonds. Patricia?
Yes.
Go ahead. You're on live with the Governor.
Yes. Thank you, Governor, for spending this time with us. I'm wondering what can be done to increase the housing for seniors that are low income.
Well, this is a really important question because we have a booming economy in our state. In fact, the Business Insider magazine just listed Washington as having the best economy in the whole country, so we're happy about that. But a result of that has been a lot of people coming into our area and driving up rental prices. So we're having more and more seniors that are being sort of driven out of the market, particularly for rental housing, because of a booming economy is driving rents. So it is more and more of an important thing that we do. And I think it's important that as we approach our housing programs, and we are doing that, we're looking at some ways to improve our housing program this year, that we make sure that we focus, not just on the people who are homeless right now, but the people who don't want to become homeless, like seniors who are facing increasing rents. And that's a really important part of our program. Now, we have done a lot for housing. We've actually, in the last several years, put over $250 million into housing programs, and some of that has been for senior housing. But going forward, we got to make sure that we don't allow this rental market to add to homelessness among seniors, and particularly among our veterans. Our veterans have a higher rate of homelessness than non-veterans, and that's just really unacceptable to us. So we've got a program to really target veterans, both housing and employment and health care and mental health care. So I want to add another thing, too, that on this housing problem that we have, it's very tied to difficulties with mental illness. And there was an earlier question about our Healthier Washington program. One of our real focuses this year is to improve our mental health care treatment services that are available to people. This is associated with our homelessness problem. Now, we've made big strides in this, but we've got more work to do to make health care more available in communities so that people can get services where they live. We have some plans to do that in the upcoming years, and I'm committed to this. Thank you.
Thank you, Governor Inslee. You're listening to Governor Jay Inslee talking about issues in the state legislative session. Now, we're going to take a couple more calls in a minute, but first we have a survey question for those of you, and there's over 8,000 people on the call right now. The way you vote on this question is very simple. I will give you some choices, and you simply will press the number on your telephone keypad that corresponds to your answer. So press 1 if your answer is 1, press 2 if your answer is 2, etc. Is everybody ready? The survey results will be shared at the end of this call. In Washington State, as we mentioned before, and the governor has mentioned, 1.2 million people are caregiving for an older parent or loved one each year, helping them to live independently and at home. They provide transportation, help with chores, and in some cases medical tasks such as administering multiple medications, dressing wounds, and operating medical equipment. AARP is advocating for the CARE Act, which would support family caregivers who perform medical and nursing tasks. Our polling question is this: should hospitals be required to train caregivers to make it easier for them to help a loved one when they are discharged from the hospital? Press 1 if your answer is yes, press 2 if no, and press 3 if you're not sure. Again, the question: should hospitals be required to train caregivers to make it easier for them to help a loved one when they are discharged from a hospital? Press 1 for yes, 2 for no, 3 for not sure. And let's go back to the line now. We have Audrey from Puyallup. You have a question for the governor?
Yes. In the state of Washington, is it required? I have long-term care insurance. So is it required to have a license, or can I have someone come into my home so I can stay here to help me when I lose my eyesight? I would rather have someone I know and trust. I was a caregiver, even though I had long-term care insurance on my husband, but the people that you had to hire through an agency were unreliable, dirty, and did not do their job. So I did it for 15 years. At first, I was still working, so I had to have them. They caused me more work than if I'd have done it myself.
Well, thank you. That's a really important question. This largely depends on the type of coverage you have as to who would be eligible to receive reimbursement for that. So you may or may not, depending on the coverage you have. And what I would suggest is that you get a hold of the insurance commissioner's office to be able to get a specific answer in your specific case. And if I can come up with a phone number here, I will, to give that, to share that with people. And we wish that there was a uniform answer to that, but it depends a lot on this private market. And we're going to look for that phone number to share with you here shortly. But I do want to tell you that this is something that in our Healthier Washington program, we really want to try to improve the prospects for family members to be able to provide this care. Now, part of that is get training during discharge from hospitals, but we want to continue what Washington has been good at, and that is to provide opportunities to have care at home rather than an institution. And I think people may know we lead the whole country, frankly, in the ability to get care in your home rather than an institution. Very proud of that. But we continue to look for new options on that. And I'd like to share with you the number to get a specific answer to that question. It is 1-800-562-6900. That's 800-562-6900, and I'll ask AARP to make that available to everybody on this call to the extent they can. But thanks for bringing this up for our discussion.
Thank you, Governor. Again, if you're just joining us, that is Governor Jay Inslee in his office in Olympia with a group of AARP's top, brightest volunteers talking about issues with the state legislature. We have the polling results back already through the miracle of technology. The question, should hospitals be required to train caregivers to make it easier for them to help a loved one when they are discharged from a hospital, which is essentially what the CARE Act would require. And 75% of you said yes, that should be a requirement, 8% no, and 17% unsure. So I think that gives you some sense, Governor, and those listening, that there is support out there for this. I have another email question that just came in, Governor, and I know you've got to run pretty soon, so we'll try and get as many in as we can. This is from Joan in Seattle. The cost of prescription drugs is making it difficult to afford care for my husband. What can be done about the soaring cost of prescription medications? You may not have an easy answer to that, but I thought I would just pose it.
Well, there is not an easy answer. I'll mention one thing, though, before I forget, is that I am delighted that our state has had so much success giving people access to coverage for medication. Because of health care reform, we've, in the 55 to 65 age group, these are people who are pre-Medicare, we've reduced the uninsured rate by 33%. So we have over 600,000 Washingtonians who have coverage that can help with this prescription cost because of health care reform. Now, that doesn't solve all the problems with costs, but I'm sure glad that we've moved forward. And this has also allowed us to allow people who are over the 65 year of age with chronic conditions who are duly eligible to have coverage. So we've made progress on getting people fundamental coverage for things, and I'm very, very happy about that. But we need to move forward to find new options. The federal government, frankly, is very important on this in their Medicare and Medicaid to some degree ability to have negotiations with the healthcare or the pharmaceutical companies. I have supported the ability to do that. Unfortunately, it's been controversial in Congress, and as you know, Congress hasn't worked particularly well the last few years in that regard. So I hope we can move forward in this regard. Now, let me mention one other thing. One of the key, our state is leading in the world of research to try to develop drugs that do prevent hospitalizations, and sometimes we can actually reduce our costs by having pharmaceuticals that keep us out of the hospital. That's actually a good thing. So that research component is very important. We're strong in it. We want to keep the biomedical technology horizons developing. And this happened right here in our state. I got to tell you, I'm so excited. Companies like Juno that has a T-cell therapy for cancer where they can take your T-cells out of your body, genetically modify them, put them back in, and absolutely be cancer killers. So I'm happy about that, those developments that happen in our state.
Excellent. You're listening to Governor Jay Inslee, and we're talking about issues going on in Olympia right now. Let's go to another live caller, Richard from Spokane. Richard, you have a question for the governor?
Main thing that I'm interested in, thank you for the call, for answering these. But the main thing I'm interested in is I think I'm getting the start of Alzheimer's, and is there research being done, or what can you tell me about it?
Well, first off, I hope that you're going to get a good evaluation of your situation and see your doc, and I hope that you're going to have good coverage for that. We've made some improvements on that. So first off, I hope you're going to take care of yourself and I hope the loved ones around you will help you as well to figure out what the best plan is for you and your family. And that's very important. Second, I can tell you that there are some promising things going on in research involving Alzheimer's. Just the day before yesterday, there was a look on some new breakthrough to really understand this disease and to understand the plaque formation that is going on. So I think that there's some reason to believe that we are making progress, and it's what I talked about just a moment ago. We're leading in medical research in our state, and I know that there's several promising research things going on. Third, I hope that your voice will be active. I think it's important for the senior community to be vocal about these challenges. And, you know, when we announced our Alzheimer's program a couple days ago, I was really encouraged that we had a couple hundred people here to talk to legislators about this. And it's very important to do that, to share the stories, personal stories, so that legislators can do things like help us pass the CARE Act. There's another provision that now is going to help families for end-of-life care decisions. Look, we believe people should have dignity and the ability to talk to their physicians and their loved ones about their individual decisions. And for the first time now, we'll be able to actually get your doctor's bill paid by the government to talk about decisions like this. And we think this is really important so that people in your situation can have the dignity of being able to talk to their physicians and their loved ones. So I'm not a physician, but that's the best three-point advice I can give, and we'll be thinking of you as we move forward to really care for you and your families.
Thank you, Governor. We just have one more question that came in on email. I mean, I think that's the way people communicate these days. Jeff from Anacortes says, I think this is about elder abuse and any legislation that might be down there. I recently saw some media coverage where a family member was isolated from another family member, and then the person acted as a guardian, took all of the money. Are you aware of this situation? I think that is sort of fiduciary elder abuse. And is there anything the state can do to protect people from that kind of elder exploitation?
Well, there is, and this is an important issue because we know senior citizens are targeted frequently. And unfortunately, it happens that even from family members, and that's just a sad comment on humanity. So we, in order to help, can help by increasing essentially our protective services for seniors, and frankly, our criminal law enforcement to stop that type of abuse. And this is pretty much a resource issue. We can use more people who are available to track down these sad incidents to really protect seniors. We could use more because we have an increasing need for that. So I have been urging the legislature, and we've made some progress to provide new additional people, essentially, to protect senior citizens and children, by the way. We've had the same situation where we've had horrendous stories of children being abused at both ends of the age spectrum. So we have improved the amount of resources on both ends of that spectrum, but we need to continue to take steps forwards on that because we're seeing increasing incidents of this. And it's financial as well. I know I had a family member who's a senior that was target of a scam that we just barely caught in time before this family member lost about $20,000. So I'm pretty sensitive to this. So if you do have any concerns about this, Adult Protective Services is the group that's charged with the responsibility. I'm going to share that phone number if I can.
Sure.
I'll say it twice, 1-866-END-HARM. So it's 1-866-END-HARM. And we certainly encourage anyone who has suspicions or concerns about a family member or a friend to call that Adult Protective Services. They can do great things. Earlier the better, obviously.
Excellent. Well, Governor, I know you have to run. I want to thank you for your time today, and we've covered a lot of ground this morning, everything from long-term care issues to the CARE Act to elder abuse. Do you have any final thoughts before you have to run for the folks we have on the phone?
Well, I do. I want to thank people for being vocal, being on this call. I I want to compliment AARP for the work they do. I have to tell you, this organization is one of the most effective organizations in democracy, and the reason is it really engages its members. You know, frankly, some organizations are kind of top-down organizations. AARP is bottom-up, and I think that this call is a perfect example of that, about how it engages its members to try to keep progress moving. So I want to compliment you. I want to encourage everybody on this call to be active, to speak up, to get to know your legislator, share your views with your legislator. Steve Theringer has just joined us. He's been a real leader on senior issues in our legislature, and I think he'd agree with me that the more people are active, the better off we will do for seniors. And speaking as a brand new 65-year-old, I'm very much in favor of this effort. So thanks very much. Steve, do you have any comments?
Well, just congratulations, Governor, on reaching that milestone. And I just think, as the Governor said, more and more folks need to inform their legislatures and their government about these policy issues as we look at the full spectrum of need out there and strengthening the system from family caregivers all the way to, nursing home and palliative care. I mean, there's just having AARP being a strong voice on all those issues is really helpful.
So get to know your legislator and tell them that most of the wisdom in our society reposes in the minds of those over 65 years of age. So.
Couldn't agree more, Governor. Thank you for your time, and we're hoping that Representative Theringer might be able to stay for a couple minutes and talk.
I'm going to have to bid adieu. Thanks very much.
Thank you, Governor. And as we make this transition, I want to again thank Governor Jay Inslee for his comments. And if you're still on the line or waiting to ask a question, don't hang up, because we're going to continue the conversation now for several more minutes with one of the legislators who has been most active, as the Governor said, in supporting issues relating to older folks. And I want to throw it back to my colleague now, Kathy McCall, who will introduce Representative Theringer. And again, if you want to ask questions of Representative Theringer, press *3 on your phone keypad now, and we will put you in the queue. Kathy?
Thanks, Doug. Yes, I'm pleased to be joined by Representative Steve Theringer of the 24th District, which includes Clallam, Jefferson County, so that's including Sequim, Port Angeles, pretty much a good portion of the peninsula itself. And Steve has been a joint chair of the Legislative Committee on Aging and Disability, and has been really involved in the development of framework that today has brought focus to several important issues around aging, including a study on long-term financing and supporting the important role of caregivers that are in our population today and the support that they provide. We wanted to talk a little bit specifically about the work of the committee and the CARE Act, a bill that you have sponsored here in the House, and we had some good news just recently that came out of the Senate. So I thought you'd be able to share that with us, some groundbreaking news. Very excited. And we'll be taking your questions about these issues and other issues that you think that the committee should be addressing. I've seen several issues that have popped up, including around observation status. So if you have questions about that, long-term care insurance, the challenges you face there, that would be great as well if you have those questions. Again, if you'd like to pose a question to Representative Theringer, please press *3 on your telephone. That's *3 on your telephone or keypad, and be connected to the AARP staff member who will note your name and the question. And again, thank you, Representative Theringer, for being here and joining us on the call. We have about 8,900 people that are on the line right now from across the state. And wanted just to talk to you a little bit more about your work on the committee and specifically what inspired you to support the CARE Act.
Well, thanks, Kathy. So as Kathy mentioned, and I think it was mentioned earlier, I do co-chair the Joint Executive Legislative Committee on Aging, and we're in our I guess, just finishing up our third year of that work. And it's been pretty productive, actually. As I think was mentioned, we initiated a long-term care study. We've initiated, getting through the legislature, the effort to develop a state Alzheimer's plan. We have looked at long-term care insurance programs. And one of the things that we worked on that came out of our hearing last year, our work last year, was some legislation to add some transparency and to the contracts around continuing communities of residential care, which I think was an issue which had, I think, is part. If you hear me speak about aging issues and long-term care issues, I'm very much into the full spectrum of care, from strengthening family caregivers and home caregivers and volunteer caregivers, all the way through the continuum to adult family homes and assisted living and nursing homes, and then, of course, palliative care. And so with the demographics the way they are, we need to look at that full spectrum. And one of the issues is this CARE Act, which has been a challenge. Actually, doctors have talked to me in my district, and in Squim, there's a gerontologist there, and he had a challenge of not being able to release his patients to anyone. So they would linger in hallways and hospital rooms. And so even though there was a volunteer caregiver or a neighbor or an assistant caregiver, the hospital could not release them to that caregiver with the right information about how to care for the person as they're being released. So what the CARE Act does is help that process so that they now can give that, the hospital can now give that information to the caregiver and help them release the client and then provide that care in their home. And I think all of us would agree that letting folks age in their homes and in their communities and having the support to do that is really a success for everybody. So I think this act will help do that a little bit.
Thank you. If you were just joining us, my name is Kathy McCall. I'm the AARP Washington Advocacy Director. And the voice you just heard was Representative Theringer, and we were talking about the role of the CARE Act. If you have a question, and we have several that we're going to take in a moment here, please press *3 on your telephone. That's *3 on your telephone keypad, and be connected to an AARP staff member who will take your name and question. So the first question we have, if we could open the line up to Ruthina.
Yes.
Ruthina, are you there?
Yes.
Go ahead.
My question is about long-term care insurance. We got started with the long-term care insurance since we were age 50s, and now we're in our 70s. But the thing is, as each year we got a new insurance company, and the price went up until we couldn't afford it anymore, and we had to drop it. So we lost a lot of money between 50 and 70 years, 20 years. So how can we get reimbursed with some of our money back? Because we sure could use it now that they've taken it all away.
Well, and Ruthina, this is Representative Theringer. I think most of us in the room realize that the long-term care insurance system is not working, and you're a prime example of that not working. And premiums have gone up, and the care has gone down, and it's not a viable alternative right now. And I'm sorry to hear that you were caught up in that experience. We are trying to look at other alternatives to provide long-term care insurance. One option would be do a payroll tax or something that would help folks that are, of course, younger, that are not in their retirement period right now, or trying to look, as I think a lot of folks realize, Medicare does not pay for long-term care. So it's really a challenge, and the people that are turning 65 have really minimal savings that they can use to provide for that long-term care. So they turn, as you did, to long-term care policies. But the problem is that system is just, the premiums kept going up and the service just kept going down. As far as your immediate concern, I would contact the insurance commissioner's office or the attorney general's office to see if there's some alternative for pursuing some way to get some of your premiums back. But I don't know of any specific way to deal with that. I don't know if there's other folks in the room that have suggestions on that. So I think calling the insurance commissioner's office would be a good way to start.
And we gave that number out earlier, so if you would like to contact the insurance commissioner's office, that number is 800-562-6900. That's 800-562-6900. They are an incredible resource. It's an organization called SHIBA under the Office of the Insurance Commissioner. That's 800-562-6900. Again, thank you. You just heard from Steve Theringer. He is the representative for the 24th District, which includes Clallam and Jefferson and counties, which are Sequim and Port Angeles, and a good portion of the peninsula all the way down to Ocean Shores. And I would like to encourage all of you to ask a question of Representative Theringer. He is co-chair of the Joint Legislative Executive Committee on Aging and Disability. In addition to asking your questions, these are great agenda items that the committee can be looking at in the future as well and kind of guide some of their thinking. So we really appreciate your calls. So please press *3 on your telephone keypad to be connected to an AARP staff member who will note your name and question. So let's go ahead and take our next question. Is this Gary in Port Angeles?
Martha in Port Angeles.
Martha.
I'm Gary's wife.
Okay. Hi, Martha. You have a question for Representative Theringer?
I do. I have Parkinson's, and I have my most important medication for that is costing me now $2,000 a month. And I'm wondering what can be or is going to be done to reduce, to I guess some control or something on the pricing of these drugs. It seems to be so erratic. I would just like any feedback from that.
Thanks, Martha. And it's nice to hear from someone from Port Angeles, from my district. One of the other hats I wear is I sit on the healthcare committee, and we are looking at drug pricing and trying to figure out some way to level it out. Has your price gone up over the last few years, or it's just been it's been just expensive from the start? So is she off the line? Or?
Yeah, I think she's off the line, Representative.
Okay. So I think what we're trying to do is look at some of the pricing, I guess I will say manipulations within the pharmaceutical industry, and trying to see if there's ways that we can level out those peaks, especially for pharmaceuticals that relate to chronic conditions. That's very challenging legislatively and policy-wise, but I think that, Martha, you're a good example of why we need to do some work on that. The other, of course, way to look at this is looking at some of the reimbursement and co-pays and the other costs and see if we can help on that side of the equation.
So again, thank you for your calls. If you have a question for Representative Theringer, please press *3 on your telephone. I wanted to see if we could take another caller, Cheryl. Cheryl, are you still available to be on the line to ask your question?
Yes, I am. I was just wondering, I have a handicapped son, and we both live together. And he is 49, and I'm going on 70. And I don't have any family left, and I just worried that my son will be put away, and we have a home that we're buying, and I think he can afford to make the payments, and I'm worried sick about them trying to put him away and take him away from the home, and he wants to stay in the home. And is there anything I can do to help stop that?
Yeah, so Cheryl, that's a that's a question and a challenge that a lot of folks are facing right now. And the committee, actually the title of the Joint Legislative Executive Committee is also, it's long-term care, aging, and disability issues. So one of the things that I mentioned earlier is trying to provide services for people to stay in their homes, and that applies to seniors, but it also applies to folks with disabilities. And so there are programs that provide in-home caregivers, or there are homes where there's independent care given to a home of maybe 3 or 4 folks that is actually not a bad alternative. So there are options for your son, either to have someone come into his home to help give him care, or for him to maybe join a home with a couple or 3 other individuals where he'd get it's very much a home-like setting where he can get some care that way. Again, I would contact the Department of Social and Health Services and see what kind of services are available in your community that would meet your need.
Great. Thank you for that great question. Really appreciate that, and thank you, Representative Theringer, for your comment. We have just also been joined by Senator Barbara Bailey, and Senator Bailey also co-chairs the Joint Legislative Executive Committee on Aging and Disability with Representative Theringer, and represents the Island, Skagit, and Snohomish counties. So we'd like to see if there's some callers out there that are on the line that have a question for Barbara Bailey, for the Senator. And I'd also like to hear an update. We just heard some good news about the CARE Act, which we're always excited to hear about. So maybe you could start us off with that, and then we'll take a call.
Well, the CARE Act just passed out of the Senate, so it's on its way to the House, and we're really excited about it. Passed out 100%. So hopefully we can get that over to the House and get it out very quickly and back here to the governor's desk for our signature. So that's good news. And again, my name is Kathy McCall. I'm the Advocacy Director for AARP, and I just would really like to say thank you very much to Senator Bailey and to Representative Theringer for your work in supporting the CARE Act. It's a nice bill that, makes a nice incremental change. We were thrilled to be able to work with the Hospital Association and look forward to having the vote in the House. We're going to go ahead and take some more questions, but if you have a question for Senator Bailey, please press *3 on your phone, and an AARP staff member will write down your name and your question, and then through the miracle of technology, I see those questions come up, and we're trying to choose those in the home districts of both the Senator and the Representative. We actually have another interesting question that came in from a caller in Port Townsend. And is Raul Huerta on the line?
Yes, I am. Yes, hello. I basically have 2 questions. One has to do with ensuring that self-driving cars will be freely available in Washington State, and I think we should move forward toward that. I mean, I'm a senior, I'm retired, I'm here, and I saw what happened with my mother who, as she got into her 80s, was having more and more difficulty driving. So that's part one. Second part has to do with, again, an experience with family members. My first language is Spanish. And one of my uncles that I took care of, as he declined in age and got into his late 80s, he could only speak in Spanish. He was trilingual, but at the end he could only do things in Spanish. So I would appreciate it if something could be done to provide that kind of service to other families that I know that are in that situation, so that when you go to the doctor, for example, that there would be simultaneous translation no matter where you went in the state. So those are sort of my 2 questions, and I love living in Port Townsend. I moved here I'm originally from New Mexico. I'm a retiree from the State University of New York, and absolutely love living on the peninsula. Thank you. And I've seen Representative Theringer at various meetings, and so thank you very much.
Raul, thanks for the call, and it's great to have you living in Port Townsend in the district. On the automatic cars or the self-driving cars, as all of us know that have dealt with the family issue of having to take car keys away from someone where it's not safe for them to be driving anymore, that's a real challenge. I think that technology in general is going to help us deal with some of the needs as we, deal with the aging demographic. I don't see self-driving cars on the peninsula in the near future, but I think, it's something that makes some sense probably in the more urban, freeway adjusted areas, developed areas. And I know the insurance companies are starting to look at that as an alternative. As the second language issue and having interpreters, I think, is a challenge across the services the state provides. Healthcare is, of course, I think, an acute area where it's very important that people understand what is being talked about, and I think we have a shortage of folks with those skills in the medical realm, but to be honest, it's something we haven't dealt with on the committee, but it's something we are aware of in the healthcare committee and the need to provide those services. So I appreciate you bringing the issue up.
So this is Kathy McCall. I'm the Advocacy Director for AARP, and we have on the phone Senator Barbara Bailey and Representative Steve Theringer taking your calls, and wanted to see if we could have a live caller, Janice Parker from Marysville, for Senator Bailey.
Hi, Senator Bailey. I myself am 64 years old and disabled, but I take care of my mom, who is 92 and has senile dementia, which is progressing. And because I live on Social Security and I retired early and still have a house payment, I'm struggling to make ends meet, and I'm depleting my 401k, and know that eventually I'm going to need some assistance because I'm losing my eyesight. What I'd like to know is, how do you qualify to be reimbursed some or paid a little so that I don't have to deplete my 401k to take care of my wonderful mother? Where do I start to see if I would qualify? I have acquaintances that are actually well-to-do people, but their parents are very low income and are getting paid when I don't know where to start the process to look into it.
First of all, thank you for what you do. That is very admirable. Some people know this already, but I took care of my mom until she died, when she became unable to care for herself. And it is one of those situations that a lot of people don't realize how much that takes from an individual, but I do identify with that. As far as you being able to get some compensation for providing those services that would ordinarily be provided at a cost to the state, I feel very confident that given your particular situation that you just described, there should be some compensation allowed for the time that you spend in caring for your mom. But we would need to go through the process of making certain people aware of that. We have people in the room here, I know, that could direct you to exactly where you need to make the first step to look into that situation. I do feel confident that DSHS can find some way to help compensate you for the time you spend caring for your mom. Anybody want to? Okay. We're trying to get you a phone number and a name, and when we do, we will interrupt and give that back to you. Would that work?
I think she's off the line, Senator.
Okay. So we're going to go ahead and this has been a fabulous conversation, and there's so many great questions that have come up, and it would be great to be able to answer all of these. But please know that if you do have questions, to contact the AARP office, and would love to have just a final closing comment. I know, Senator Bailey, you've got to get back to the floor for votes, and Representative Zeringer, I know you have a very busy day as well, but maybe a couple closing comments.
Just briefly, to let you know, we are on the floor of the Senate voting right now. I don't want to miss any votes and apologize for not being able to spend more time with you, but this is a really great avenue by which we can communicate, find out what your concerns are in a very concise way. I thank everybody for calling in and being a part of this today. We've taken some good notes. We have all of your questions electronically captured, and so those that didn't get on the call, I'm sure we'll be able to get back with. But thank you for your interest, and thank you for being a part of an organization that is really striving to help our aging population. So thank you very much.
Right, and I would just agree with the Senator. AARP provides a lot of good input to our committee and monitors these issues so well that they're a real partner for us as we try to develop policy moving forward, addressing the age wave. So feel free to use them or contact our offices to move issues forward that you think need to be addressed. And appreciate your participation in the call, and we're glad to be able to address some of this agenda as we move forward. So thank you.
So, and thank you to everybody that's on the phone with us today. Really appreciate the time that you've spent with us, and want to make sure that if you are interested in supporting the CARE Act, you can call the legislative hotline here in Olympia. That's 1-800-562-8000, and ask that Senate Bill 6327 and House Bill 2424 are passed. So please, I encourage you to contact your legislator at 1-800-562-8000. And I also wanted to get back, there were several calls that we saw on the screen related to long-term care, and we have a number for you to contact there. It's 1-800-677-1116. So if you have questions about long-term care and needing assistance and supports and services, please contact DSHS. Also, please contact your area agency on aging in your community. They are a terrific resource of information for you for long-term care and assistance. I thank you all for your time. I thank you for your great questions, and I thank the staff in our Seattle office. And thank you again. We look forward to talking to you soon.